Hey all, Dr. Tim Lind here, and I'm going to give you a little short video on some different things you can do if you struggle with lower back pain. I see people every day in my office that struggle with low back pain, and we do some things to help them out, but we also show them some things to do at home to help improve their situation. What we need to talk about first is kind of your spine, so you get an idea of what's going on. So this is a picture of your spine, a side view. So this is the front and this is the back right here. And this is the vertebrae and the disc right here and here. And then it makes up a little hole right here. And this little hole is where the nerve actually exits the spine. So if someone's standing, we're going to add compression on that disc. And a lot of times if there's damage, or even if there's not damage, we can cause compression on this nerve right here. It leaves the spine. And even when we sit, it adds that much more compression. So one thing that we do in the office here for these people is something called spinal decompression. And basically what that is they can lay down and we are gently opening up the posterior joints right here and opening up where that nerve leaves right here. And a lot of times people with disc problems or even post-surgical people who have surgery, it benefits a lot of people that have had surgery as well. But by doing that, we can get that movement going to kind of free up that nerve. So what can people do at home? Well, there's one thing that I just highly recommend. People ask me all the time about inversion tables. Are they good? They have their benefits. There's something else I like better that works better, I feel, and there's less stress on your knees and your ankles and your hip joints. So let me get this on my computer and let me show this to you here. So this is what I recommend people to do. Okay, get an exercise ball, and what this is going to do is it's going to take some pressure and stress off the lower spine right up in here. She's laying a little bit too far forward. If she would rotate back a little bit where her knees are really close to the ground, the weight of her legs is going to cause some decompression right in here. And there's still going to be some pressure on the spine, but the weight of the legs could kind of distract that out. And by doing this, you're going from actually compression on the spine to actually close to zero and maybe even possibly a negative G-force on the spine. When we're doing in the office on the table, we can get to definitely a big time negative G-force on the spine right here, which is going to open the posterior joints to allow people to start feeling a whole lot better. Doing this at home, I just recommend to do it a minute or two. Don't do any longer than this. This is one of those most beneficial things that people can do at home. I just highly recommend that people do this. And sometimes it's a little bit awkward trying to figure out how to do this. If you have questions about it, just call me. I can show you what to do. If you're in the office here, I've probably shown that to you, but if I haven't, definitely let me know and I can show you this as well. So I hope you found that beneficial. And we'll talk about other topics next time. I've had a few people respond and say they want some more information about different topics, which I'll be covering. But if you do struggle with low back pain, I do this myself. I do it. I don't have back pain, but we're compressing our spine all day, every day. It's something that's going to be beneficial for everyone to do. So until next time, it's Dr. Tim Lin. I'll see you guys soon.